Silikonla meme büyütme ameliyatı
Breast augmentation surgery with silicone implants is one of the most frequently performed surgeries. It is one of the most satisfying and happiest surgeries. Breast enlargement is usually done after the breast development is completed. We apply it to those who are not satisfied with the appearance and smallness of their breasts and who want to enlarge it. Especially young patients apply to us with the request of breast augmentation. Generally, after the age of 18 to 20, breast development is completed and there is no growth afterwards. Then they apply to us for breast augmentation with implants option. They also apply to us to after give birth, breastfeed, or have lost breast volume with age and regain their old fuller breasts. Therefore, the aim of both is to enlarge the breasts. We use breast implants for breast augmentation. However, the size and shape of the implant used are different, or the surgical area where we apply the implant is different. The areas where we apply breast implants, it can be the lower part of both muscle and breast tissue, which we call sub-muscular, sub-mammary gland or dual plane. The new breast implants are called smart implants. The feature of the smart implant is that the silicone gel in it makes it look good when we stand upright. During body movements, the silicone needs to be replaced slowly within the implant. Because when you stand upright, the consistency of the gel inside the implant changes. What we call the décolleté of the upper pole breast. It is very important for us that the area looks beautiful because it fits the area. Therefore, full or high-profile implants, which have a full upper part, the upper apex is below the nipple, and the apex is more protruding, give a better appearance. We call it a smart implants because it is important for us that it gives a natural appearance when we use it in a dual plane or when it is used on the muscle or under the muscle. When it comes just under the muscle, the implant stands higher. This is in younger patients, that is, in the mammary gland. Maybe submuscular applications give very good results in patients who do not have breast gland development much. Those who have breast tissue but want the upper pole, that is, the décolleté part of the breast, to be fuller. We can apply it under the mammary gland in our patients. But I think that the most natural looking one among all is the dual plan, which we call the dual plan surgery, that is, on the top, under the muscle, and below, under the breast tissue. I have experienced the dual plan is the method where we can get the most natural image that we can use in all silicone breast implant applications, that is, in all patients. Therefore, the area where we can reach this dual plan most easily and where we can place the prosthesis is to place it by making an incision from the area of the breast fold under the breast. Breast augmentation surgery takes an average of 1.5 hours. It is applied under general anesthesia. It is an easy-to-apply surgery performed in hospital conditions. But the pain after it can be felt a little too much, especially since I applied the dual plan, more muscle pain is felt. This pain takes up about 3 to 5 days. Usually, maximum pain is felt during the first night, but then it gradually decreases. Apart from this, the pain decreases in a week and gets better every day. We want a special bra to be worn after breast augmentation. The feature of the bra is similar to a sports bra with thick straps, elasticated front closure, wire-free, and traceless seams. Using this for a month. Needs. After the 10th day of the breast augmentation operation, I definitely recommend massage. And the rare but most important massage is to reduce the capsule contracture complication. Massage is therefore very important. Before I talk about it, I need to explain what a capsule is. Silicone is foreign material to the body. Therefore, when we put this foreign material into the body, silicone reacts against it. Tissue surrounds the silicone implant with a fibrous layer, that is, a layer we call connective tissue and separates it from the body. We call this the capsule. This capsule, which is formed in the form of a very thin layer, is something that should be normal. Capsule contracture means that this capsule tightens over time and compresses the implant. When the implant is stuck, the prosthesis here is no longer in shape and causes excruciating pain in the breast. This is called implant contracture. This becomes a complication of the operation and needs to be operated again. This implant contracture. Precautions need to be taken to prevent it from happening. Because it is said that there is not only one known reason for its formation, there may be reasons. One of them to prevent capsule formation is to massage the breasts from 10th day so that it does not narrow, then the formation of that capsule begins and usually in a month being completed. Performing the massage regularly within a month ensures that the capsule is in the range in which it is formed and the volume of the implant. Other than that, I don't use drains. Because drains increase the risk of infection, it also increases the risk of capsular contracture. What other complications can come with all this? We said that there may be pain, swelling and edema may occur in the first week. This is due to the reaction of the silicone. It happens as an action, as well as an action that can occur due to surgery. 80% of this passes on average in the first month, while it completely passes in the 6th month. So we say that we see the last image of all surgeries, that is, the final image of 100% in the 6th month. In the 6th month, breast appearance is fully settled. Because the silicone presses on the tissue, the full image you see at first becomes a half-size low look. In other words, in the 6th month, the final image is seen when the breast has descended to its normal position and its volume has taken its final form. Breast augmentation surgery with implants is an operation that corrects the asymmetries, gives more volume to the breast, and obtains permanent results. Silicone implants are for life. It is produced with a guarantee and never changes its shape. That's why the results are very long-lasting. Breast augmentation surgery increases self-confidence and has happy results. It is a beautiful surgery that is permanent and not too difficult.
Çok zor olmayan güzel bir ameliyat.